All right, let me know that my sound is okay. I put my mic a little bit lower. So just let me know if the sound is okay. I felt like in yesterday's live, my mic was a little bit too loud. All right, if you are watching, then make sure that you let me know where you're watching from. I have monitors on this side and this side. So if you see me looking to the side, I'm looking at the chat. I need to be an octopus when I do this, so I have multiple arms. Today we're going to be talking about pay. How much how much am I making as a nurse practitioner, right? Why am I doing this, right? Is it to brag? No. I cannot reiterate this enough. I am not doing this to brag. I am not doing this as a competition. I believe that pay transparency is very important. If because right, if you're an NP, or let's say you're a new NP and you have no idea, if we don't talk about pay, you could be getting shortchanged and you have no idea. So I feel like we need to be transparent about pay, because studies do show. I mean, it is what it is. If you're female, right, or if you're a minority, you tend to get paid less than what a white male would get paid. It just is what it is, right? So Nurse Liz, I can't believe you're tuning in. Hi, thank you. So Nurse Liz, check out her channel. She has had me on her channel as a panel member. Her channel is great, over like 100,000 subscribers. So big, she's a big channel, and I'm like a little fish. So the fact that she is logged on means a lot. So thank you for being logged on for today. So, let me I don't have Rachel like you have Rachel. So I'm not in the habit of like highlighting comments. So yeah, make sure to like this video if you're all about this convo. Okay, so that being said, I've made a video before about pay, and inevitably it's basically like a roast session for me. Like, people roast me like, I make this much money as an RN, and if you are making more money than me, I'm happy for you. As an RN, I'm happy for you. I will go ahead and preface it by saying, if you are a travel nurse, you're probably making more money than me. This is not a competition, right? If you're doing better in regards to financially or how much money you make, that's excellent. Happy for you, right? I'm in Florida, so I can already go ahead and tell you, if you are in New York or California, you are definitely making more money than me, probably, even if you're an RN. So when I started, I have notes here that I wrote. So when I started as an RN around 2014, as an RN in Florida, and I'm giving you my RN pay first, because when I tell you my NP pay, inevitably people will be like, I can't believe you're making that little money, blah, 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 blah. So I'm trying to show you, like, I am getting paid more as an NP versus when I was an RN. So when I was an RN, I started at around $21 to $22 an hour back in 2014. I talked to my husband, and where was his notes? Okay, my husband started at $25 an hour at his hospital. This was about 2 years ago. He recently, again, this is in Florida, right? If you're in New York, California, one of those states, you guys, what you're making is astronomical, right? Great, happy for you. So he moved companies, and now he's making $40 an hour. Just giving you perspective. So when I first started as an NP, this was 3 years ago, I made a video about it. I started at $45 an hour. My job got it was like reassessed our duties for everything that we were doing. And I was like 2 years ago, from 45, I started getting paid $53 an hour. Now, I will say this, I do not work 40 hours a week. So I'm getting paid, again, in Florida. Oh, and now we got, last year, now I'm at $54.36. That's how much I'm getting paid an hour at my full-time job. I do not work 40 hours a week. My job is a little bit wonky with the hours. So some weeks I'm working maybe like 27 to 30, and other weeks I'm working around 37 hours. So that adds up over time, right? because I don't work 40 hours a week, my husband right now, he's still at work. He's an RN and they're short staffed this week. He doesn't work in a hospital, but I would say what he does is similar to like a dialysis nurse schedule. So he's still at work because they're short. So right now he's going to be, so Nurse Liz, let me put that. Nurse Liz is saying that she started at about $45 an hour in North Carolina. So um, that gives you some perspective there. So my husband right now is still at work and he's going to have overtime this week. So because he, as an RN, he works overtime and he gets gas mileage reimbursement, at the end of the year, we're probably making around the same amount of money. So it's completely feasible to be an RN and make as much money as an NP. Now, I do have a 1099 position, and a 1099 position is basically where you're an independent contractor and you don't get any benefits. That's basically what it is, an independent contractor. So you work a set number of hours. Now, with that position, I have the potential to earn up to $100 per hour because I'm paid based on how many clients I see. It's a telemedicine position. So I do that part-time right now. Why do I do that part-time? Why don't I do that full-time if I have the potential to earn up to $100 an hour? Because it's based on how many clients I see. And the schedule is not, it's not a guaranteed, right? It's not guaranteed that I'm going to be making $100 an hour all the time because it really is based on how many clients are waiting and want to see a provider. So if there's no clients, I'm not getting paid, right? So for in the meantime right now, I rather get less money and go for the safe route versus be stressing about I don't know if I'm going to have enough patients or make enough money. So let me know your thoughts. Also, if you're tuning in from another state, let me know what the average is that you're making. Feel free to ask me if you have any questions about RNs, NPs, I'm all game. So, um, do I regret becoming an NP? So if you've watched my channel, you are probably tired of me telling you I have an autoimmune condition. I have Sjogren's, and basically if I sneeze, I pull a ligament, right? So I cannot, like my body cannot physically take being an RN, right? Bedside, I just don't think I have the stamina for it anymore because of my autoimmune condition. I've been dealing with plantar fasciitis for like 4 years, and because of the autoimmune condition, it doesn't heal. So my hat's off to you if you are able to work on your feet full 12 hours, pulling patients up the bed and pushing the cart on wheels, or the cow as we used to call it. So my hat off to you, right? Travel nurses, right now is your time with all the money that you're making. Phenomenal, right? So there's a lot of money to be made in nursing, and it doesn't necessarily, you don't have to be an NP. You can be an RN and make even more money. But for me, I do enjoy being an NP. I was at the point when I was at bedside where it didn't happen overnight, right? I was a bedside nurse for 5 years before I went to NP school. And oh, I think Nurse Liz. So Nurse Liz says, did you have to negotiate a salary increase, or did you increase by pay by switching jobs? Because I'm awful at negotiating. So thank you for bringing this up. So I'm awful at negotiating too. And I actually wanted to talk about this, but I forgot. So thank you for reminding me. So I started working first for a pain management clinic, and they offered me 45 an hour on the spot, and I didn't negotiate. And why don't we negotiate, right? One of my male NP friends, he negotiated with a different company that he left, and he got I'm talking about like $10,000 more than what he was offered, right? So that's a good point. We need to be better at negotiating. Nurse Liz, what is it about negotiating that is hard for you? Like, why are we so bad at it? I don't know. It's something that I need to do a self-examine and see. I feel like I'm just grateful to be offered a position, and I don't want to, it feels awkward, and I don't want to appear as if I'm like money, like only driven by money. It's very strange. I think as women, professionals, we need to get better at negotiating. So I didn't negotiate a salary increase. When I went to the other job, they offered me the same rate, not salary, sorry, the same hourly. And again, I didn't negotiate. But the company did an so Nurse Liz is saying that huge imposter syndrome on my end. I'm lucky they even want me, and I don't want to oversell my skills. I think maybe it has to do with a lack of confidence, or also like, as my parents, right? I'm not speaking for Nurse Liz, but my parents, like, we were always raised to be so polite, to just like say yes to everything. And I think it's dangerous. I mean, we want to discipline children and we want children that are obedient, but at a certain point, we do need to advocate for ourselves. So I don't know. It's something that I'm glad you brought up that we definitely need to work on. Okay, I have my ADHD. I lost track. I can't remember what I was saying. The wage gap is so different in Tennessee. Let me highlight this comment. The wage gap is so different in Tennessee. As a new RN, I make $31, and that's with the night differential. But when my 1 year is up, I can make $51 for either Friday through Sunday or Saturday through Sunday. Thank you for sharing. So that's good, right? That may be another option, right? If you don't want to go back to school, you can always move states. And the nice thing about, for example, California is they have nurse-patient ratio. So on Nurse Liz's channel, she has Nurse Scott. You can check out their channels, and Nurse Adrian. And it's a world of a difference when they describe what life is like in their hospitals. Because our hospitals, our working conditions were just so deplorable and overwhelming, I had to get out. It was like self-preservation. So Stonebone said that they can make $75 to $85 for float pool without benefits. That's another option too. You can just be afloat and you work a certain number of days per month, and it allows a lot more flexibility. So I did pick the job that I picked for work-life balance. It's not salary, but I get paid hourly, but also there was no on call, no rounding in the hospital. So you want to be careful about who you work for. And yeah, weekend shifts are where it's at. So you want to be careful which doctor you work for. When one of my friends started working for a physician, he was basically treating her like a workhorse. Hi, Nurse Adrian. Wow, all my friends are on today. I feel so special. I was just talking about you, Nurse Adrian. I don't know if you watched what I was saying, but I was just talking about your channel, and I was talking about how in California working conditions are so much better than elsewhere in the country. So me personally, I don't regret becoming an NP, because it's just I was become like a sponge, right? So there's going to be certain physicians that motivate you in a positive way. And what I mean by that is they're super. So Nurse Liz says, how was Adrian's vacation? We all missed Adrian on Nurse Liz's channel because we missed her expertise. She's like a walking thesaurus, or encyclopedia, not thesaurus, a walking encyclopedia. So anyways, so there's doctors that are going to motivate you in the correct way. And shout out, I don't think he'll ever see this, but there was one doctor, Dr. Sornabala. He was amazing, so smart, so kind to patients. Whenever he was rounding or on the floor, like, I was shadowing him, like I was behind him like a shadow, because I wanted to learn and absorb everything from him, right? And I've learned so much from him. And then there were other physicians that you are like, okay, I don't ever want to be like this physician, right? And that motivates you to be better because you see how they're, and you're like, that the example of what you don't want to be like, right? Do what fits your A to Z, really easy, then reverse engineer it. Yes. So I was just ready for a change. I felt like I really liked the diagnosing part, it almost felt like a mystery, like this patient presents with these symptoms. What do they have? What labs are we going to do? I just wanted to increase my scope of practice and be able to prescribe medication and diagnose, because there's, I think it was Rogue Nurse that mentioned something about like, she likes to be in control, and I'm an overachiever, and I just, to be have to wait for a physician to write an order for something that needs to be done. It's like sitting on your hands, and you're just like, oh my gosh, can I just do this? So I decided to go back to school for it. Wow, Mr. Midwife is on. Hi, 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 hi. So feel free, any of you. And actually, like, I don't, Liz, I'm gonna have to get with you later to see, like, if you guys ever want to hop on when I'm on, but I don't know how to share my link. So I'll ask you later. So Nurse Liz is saying, if you're just hopping in, leave your salary questions or share yours if you're feeling sassy. Transparency is how we all get better contracts. Amen. Stevie says, I'm a new graduate nurse in New York looking for a job. Do you have any questions about getting a new job? Just there's such a demand right now. So Mr. Midwife, he's being transparent with his pay. He's saying 150K is what he makes. And once again, showing, what state are you in, Mr. Midwife? Once again, showing the discrepancy in pay between, for example, again, we don't know what state he's in, but between males and females, and being better at negotiating pay. And again, it's something that we can always learn from each other. And I do think that that's something that we need to do to advocate more for ourselves. So B. May said, aren't you burned out and emotionally destroyed by this industry yet? So when I was in bedside, I was getting to that point too. I was getting burned out. Keep in mind, this was before COVID. So there, I came to a point where I tried to talk to our manager and advocate for better nurse-patient ratios. I was part of they have a committee, I forget the name, like Nursing Practice Committee, NPC, I think is what it's called. And, I tried, but when I saw that nothing was changing, I said, I need to get out. So Nurse Adrian said, NP pay and benefits in Southern California may be difficult to beat union staff nurse pay. However, that's grueling work. And yes, that's what I was saying before. It's like, now become a nurse practitioner, because don't do it necessarily for the money, even though I am making more money, right? But you may need to shift your perspective. Like, it's a shift in role. What role do you want to do? Because life is not only about money. You need money to pay your bills, but you also want to be happy with what you're doing. So what role do you want to play? Do you want to stay in the bedside and help patients that way? Or do you want to now be in a more like a primary care clinic? So everybody that's on today, does anybody have any advice for Stevie about getting a new job? Personally, I would say watch YouTube videos on answering interview questions. For example, questions like, tell me about yourself. Where do you see yourself in 5 years? Also, like, for what would you do in this scenario? Like, know certain protocols. They also ask questions like, what did you do with, and since you don't have experience, then you could, like, a benefit of you not having experience is say, I'm fresh out of school. I know the latest evidence-based practice, the latest protocols, and kind of use clinicals and the fact that you just got out of school as a way to say, like, you're fresh and you're ready to learn. So Mr. Midwife says, yes, exhausted, but CNM was a good change. Nurse Adrian says, I'm all for $50 minimum wage for RNs nationwide and minimum 200K for NPs. Honestly, I think that we deserve that. B-May says that they're like a walking zombie right now. No one will let us have lower ratios or decent hours. And that's exactly what I said when I started this discussion. It's like, I'm not doing this to brag, right? And I just prioritized I just prioritized my physical health and my mental well-being. And not all NPs jobs, some NP jobs are a nightmare. I'm not a typical Monday through Friday person, right? I can't do that. That's why the job that I got, it's a different schedule. Like I'll work like 11 hours a few days out of the week, and then I'm completely off. Javier said, "This is my third month doing clinicals, still nursing student. At times, I don't know how to connect what I learned in school with my clinical experience, or I don't know what I'm doing. Any suggestions?" So, first, be kind to yourself. It's very normal. It's going to take you a while, but I would say try to maximize clinicals and observe as much as you can and have an open mind and practice as much as you can in clinicals, and it will come with time. So Nurse Adrian says in 2019, staff tele, I made 125. Wow. So you probably weren't on. When I started on a med tele unit back around 2014. I started at around $21 to $21 an hour. So huge difference. Oh. Sanela, hi. Thanks for joining again. You were on yesterday. Thoughts on holistic medicine or the holistic NP? Can you be a little bit more like give me an example? There's like things like allergy testing, and again, we had talked about this on Nurse Liz's live the other day. Allergy testing, where they test your blood, can be highly inaccurate. So all these tests now, that not only are they inaccurate, but they can give false positives. So things of that sort, I wouldn't be too. Me personally, I wouldn't want to do anything like that, just because I don't feel like the science is there. But if you want to clarify, yeah, sure. So B May says, I'm super hesitant to keep going with education in this field due to burnout, but I don't see another way and any other way out. So so if you can shadow an NP, right? Because you don't want to, that's a very smart thing to say. You don't want to get into um, a situation where you're like $20,000 more in debt and then you try NP and you hate it, right? So definitely if you can shadow an NP or talk to different NPs. And keep in mind, BMA, there's different routes. There's acute care NP, which works primarily in the hospital. There's pediatric, there's NICU, there's psych, right? I don't want to say I regret, but I truly do love psych. And I actually had got accepted into a psych NP program of like postgraduate certificate program, but I got long COVID and I had to withdraw because my health just wasn't there. But I love psych, right? Psych is in like, and now with telemedicine, I don't know if you're an extrovert, introvert. I'm an introvert, but you could definitely do visits at home in the comfort of your home. So just see what is out there. See if you can shadow someone. School doesn't prepare you experience well. Hopefully your program is preparing you somewhat though, right? Because that's kind of scary if you feel like no. So Nurse Adrian said that there is niche with cannabis, and I predict will be with some other niche opening too. Definitely, that's something that is very hot right now. I've seen a lot of job openings for that. Also, there's her name is her. She has a Facebook group, Remote Nurse. If anybody's interested in remote work, check out Remote Nurse. She has a Facebook group for RNs and for NPs. Nurse Liz says, for new job hunters, I'd go slow. Better to take a job as a bartender or something until you can find a safe job that is very willing to teach you and support you as a new grad. Worth waiting for that. And that goes for both RNs and NPs, right? You don't want to get yourself into a bad situation out of desperation. So find something else in the meantime until that you can find something that safety is first. You don't want to go to school all these years and put your license at risk. That would be my first thing. But the other thing is that you also don't want to not accept any offers because it's not your dream job, right? You could always work somewhere for a year, get your experience, and go somewhere else. You can always do that. So Mr. Midwife says, acknowledge to the hiring person, I'm not a doctor. I don't know it all. I will need some direction. Shows your place in humility. Definitely. And that's Stevie, always start from a humble place. Say, I think when you're getting a new job, if you show like, I don't know everything, but I'm willing to learn and I'm open to learning, that's huge. My first NP job that I got was working for a pain management physician for interventional pain management. And he was extremely knowledgeable, very kind doctor, and just showing them at the interview that I was willing to learn from them and having a positive attitude. I think that's the number one. And of course, I'm always respectful, right? Kind of tongue in cheek. I said before, who wouldn't want to make the same amount of money that they make, right? But obviously, we're not. But and always just treating them. When I was working for him, because where I work now is very independent. Like I don't technically we have like a medical director, but even in Florida, after 2 years, you can apply for an autonomous NP license. So you're technically not working with any oversight. But when I was working for him, I acknowledge that he's my boss and he does know more in the specialty because he is a specialist in that area, right? And just always being humble and down to earth, being respectful, that will get you a long way. So B May is saying, I'm saying that because of how much money is on the table and we're not the ones who get the big money, even though we do the work. And that's that's my point that I was trying to say is a lot of times it feels like we're doing so much work and we're not getting compensated accordingly. Nurse Liz says that she agrees with Mr. Midwife. Nurse Adrian said that she started in 2007, $26 an hour in a union hospital. B May said it's not about education or experience when deciding pay. It's about how much we generate for hospitals and insurance companies. We even are as NPs, we get reimbursed less, so that's why we'll never get paid. We'll never get paid what MDs get paid to either. Like their reimbursement is higher with the insurance companies. So Mr. Midwife says, hate psych. That's why, thank God, right, that we all have different likes and dislikes because everybody needs to be taken care of, right? Mommies need to be taken care of and patients that are hurting mentally need to be taken care of. Stone Bone says, my advice for the nursing student is finding a job is do not let the signing bonus drive which hospital or job you pick. Research all nursing careers. I agree. I cannot emphasize this enough is, first of all, if you sign a bonus and you leave within a certain amount of time, you're going to lose that bonus anyway. And try to shadow as much as possible. I know it's not always feasible, but that if you could just do your research. I have ADHD. I'm impulsive. I'll just accept things and be like, sure, I'll work here. And I need to do more research, right? Because that will save you so much more time. Trust me. There's been plenty of things I've done that I haven't researched that I wish I had researched before. B-May said, started 2007 at 26, then bumped to 27 after a year. No sign-on bonus at the time. What state are you in? Look at what you're billing and how much you bring in. And keep in mind, like, I never wanted to be a physician. And I initially never even thought I wanted to be an NP. Like when I started at bedside, you change as a person, you change and you grow. And that's the beauty of life. And for me, the beauty of nursing is that you can go into so many different directions as a nurse than even as an NP. You're not tied down to one specialty. So that to me is I really enjoy that about that part, that we can work in a variety of environments. And B May says that we need on-the-job training and don't have much support once we're on the floor. 100% agree. So Nurse Liz says that helps with negotiating salary because you can literally see how much money you make the office and you can bring that to the negotiating table. Correct. Yes. So if you can crunch your numbers, and when we were in school, they actually had a class in this, like how much we're bringing in, and then that's how to negotiate salary. Which obviously I didn't learn very much because, like I was just saying, nurse list before, I am not very good at negotiating salary, but definitely do that. See how much what you're billing, what you're bringing in, bring those numbers to them, and I think that if you can approach this from a quantitative level versus not saying like I deserve this much because I have this. No, like if you can bring facts, like this is how much I will bring to the office. Therefore, I mean, again, I don't numbers. I'm just going to throw out like some random numbers. I have no idea, and it's bad, right? That I don't know. But let's say you're bringing in like $500,000 in revenue a year, right? Then you, by showing them that, you can tell them, look, I earn at I can, if I'm bringing this much in, I can be paid. You can afford to pay me at least this much. Someone said, what are your thoughts about NP and CRNA for a fresh BSN nurse? Well, so CRNA requires hospital experience. It requires ICU experience. So can't really do that as a fresh. And then as an NP, I mean, I think minimum for a nurse, you minimum I think should be working 2 years before you do NP school, because like that's what Nurse Liz was talking about before. We get clinical hours, but I think my school was like 750 hours. But again, I was a nurse for like 5 years, whereas residency programs are hundreds and hundreds of hours, right? So I think it's not a good idea to not get RN experience, because NP programs are banking on the fact that you do have RN experience when you go in there. Let's see. BMA says, I think nurses who try to go to CRNA or NP right away are in a fortunate position to be in school for that long and are motivated by the money, have a rude awakening. Just make sure that what you're doing is because you just make sure that what you're doing is something that you will like doing, because of course CRNAs are the highest paid nursing in general, right? There's always exceptions. I'm sure there's some nurse out there that's not a CRNA that is making lots of money, right? So there's always outliers. But what I'm saying is, and on average, the CRNAs are the ones that make the most money. I know for me though, that's not the environment for me. No. So make sure that you don't just pick a profession that it's all about the money. Let's see. Nurse Liz says, Bridget, what are your thoughts on doing an NP residency program, even though the pay is way less? For me, I think it would definitely be worth it. I'm a nerd. I love learning. I think that that would set you up. You do a residency program, you get a pay cut, but when you're finished, you can negotiate a better salary, and that sets you apart from other candidates. And depending on what state you're in, there is a lot more competition for NPs versus RNs. Like RNs at this point, they're so short. You just walk on the. I'm very sarcastic, guys, and sometimes you can't tell my humor. Like with me wishing we got paid as much as MDs. Like, of course, in like a magical world, I would love that. I know that's never going to be possible, nor maybe should it be, right? But like, so I was going to say, like, you can literally walk onto any floor right now in nursing and they'll just give you the job. Like, right. I'm not trying to offend anyone. Like, I know you still have to interview and you have to put forth effort, but what I'm just trying to highlight is the fact that there's, it's a lot easier right now to get an RN job versus an NP job. So I think that residency programs are something that actually we should be doing. And please go to a school that is reputable, because we're already under fire as NPs, right? We're already looked down as less than, that we don't know enough. So you don't want to go to a diploma mill just to get the degree and then you don't know what you're doing. And not only that, you have patients' lives in your hands. So if you don't know how to treat them appropriately, that's dangerous. So B-May says that was Arizona, and physicians should be paid well too, but I'm tired of hearing the same excuse to keep our pay lower when we're generating the lion's share of money. So again, Dr. Swarnavala, he'll probably never watch this, but he was such a great doctor. I remember we were in a room with a patient, and the patient asked him, he was like, are you the surgeon? He's like, no, I'm just the little attending. He's like, I don't make the big bucks. So, physicians, they're, especially now that the way things are going, like physicians are part of a hospital group instead of having their own practice. Like they're also under a lot of stress. They're overworked. They're not making that much money either. I think, again, in a perfect world, we should all be making more money, right? Like Oprah, you make more money, right? But at the end of the day, too, I just want to say that it's not about how much money you make, but it's about how much money you keep, right? Because if you make a ton of money, but you're squandering it all, then there's no amount of money in the world that is going to let you keep it. So, Nurse Les says, definitely agree. No reason we can't make more as well. Aesthetics is huge right now for NPs. That's a way, if you're into that. I'm not into aesthetics, like me personally doing it to other people. So but if aesthetics is huge, if you could get into that, it's another way to make a lot of money. um, Hospitals see nurses as an expense, unfortunately, which is ridiculous since safe nursing staffing saves money long term. Yes, I cannot like reiterate this enough or applaud this enough, right? Again, I would do research for my unit and be like, listen, it costs you around $86,000 when you lose an experienced nurse. Like, why not? No nurse here is getting paid $86,000, right? Why not hire two more nurses and staff us appropriately so you don't lose one? But it fell on deaf ears. So, B-May says mental health is more important than money. Can't have one without the other. Exactly. If you just chase the money at the cost of your mental health or your health, then you're going to spend all your time trying to get your health back. B-May says she appreciates the sarcasm. Thanks. I love The Office. So yeah, let's see. So Nurse Les says, OMG, yes, please don't go to school where their primary advertising is we can get you through fast. Um, it's Fell says, is it better to be NP or PA? So the PA model follows more of the medical aspect of it. Now, as our NPs, we also do get what I do. So what I've seen is the strength of PAs is as RNs, we take anatomy and physiology as a prerequisite, but we don't normally revisit that in depth, right? PAs get time in a plethora of clinical settings, and the bonus of PAs is you guys just, I believe, right? I could be wrong, as NPs, they've branched out our program so much, right? There's NICU, like I said, there's PEDS, there's FNP. So as PAs, I believe you guys just have one program and then you can work in a variety of settings. Whereas me, if I want to treat more than just anxiety and depression, I have to go back to psych NP school to be within scope of practice. And then I've also seen that PAs are very strong when it comes to anatomy physiology. What I like about, so NP school, like at our program, we did learn a lot about just, again, primary practice, what you would see in primary practice, what medications are we giving, what diagnoses are we giving. And then there is also an emphasis on like holistic care, whereas like the medical model is like, this is broken, let's throw some medication at it, right? Whereas nursing at times focuses more on like the whole patient and giving them education and what they can do better and lifestyle changes. So that's what I like about being a nurse, an NP. So Nurse Les says, if you know what you want to do exactly and don't think you'll ever change your mind and you're already a nurse, NP is a good route because the education is specific to that setting. Correct. Whereas if you want to be a PA, your credits may not all transfer. You may need to go back to school for an extended period of time. I know that PA school is very, very competitive. So, yeah. Yes, Parks and Rec is also good. Anyway. So Nurse Les says, and patient population, if you aren't sure or aren't a nurse already, go the PA route. more well-rounded education, in my opinion. Yes. Um, like I said, because I was already in nursing, like I have zero regrets that I just continued in that trajectory because it was the most efficient. So again, ADHD, impulsive, and changes mind frequently. First, I went to school for nurse educator, so not really efficient because I ended up doing a bunch of stuff, right? First went to school for nurse educator. After like almost done with my education program, like I had to shadow an NP and I was like, wow, this is really cool. So had I taken the time to just shadow an NP, or I just thought I didn't want to be an NP, but I never shadowed. And then when I did it, I was like, oh, this is actually kind of cool because you can teach with an FNP degree, but you can't be an NP with a master's in nursing education. So I could have saved money and time. Um, Mr. Midwife says better to be an NP. I'm biased. Can you, me personally? I mean, again, I'm biased too because I'm an NP. I like our profession. But Mr. Midwife, feel free to write any other reasons why you think it's better to be an NP versus a PA. I just don't want, I gave a lot of pros to PAs because I am biased. So I recognize my bias and I was trying to show like the pros of being a PA and not talking bad about them because they're also a great profession. So B. May says that PAs have the respect with a lesser scope, better work-life balance, and high status with lots of options. I don't know enough to say if they have like a higher status than us. I'm not sure. But this is true that the public is still figuring out what an NP is, right? Most people that I've seen will think like uh, an NP is just an RN that woke up one day and was like, I think I'm just going to start treating patients. Like the normal patient population doesn't even realize that we have an advanced degree. So Mr. Midwife says that he's locked into women's health, but he loves it. And that's the important thing. You know, obviously I changed my mind a lot, but if you know what you like, then go that, and you're already in nursing, then pick that specialty and run with it, right? So B May says, my dad was a PA. Okay. So Nurse Les says that women's health surprised me with how much I love it. Never in a million years would I have thought I would love women's health, but that was my jam in primary care. You know, that I was surprised too. I was surprised too, and I thought I was going to hate it. And no, it actually was not bad at all. Um, I don't think I would have liked to, like where I worked, it was at a university, right? So it was it was like no pregnancy, young, healthy females, but I enjoyed the aspect of like if they were coming in for STIs, like making them, like giving them care that was non-judgmental, giving them education, treating them, making them feel better. So that was just like just being there for them. It actually was a very enjoyable experience. So B. May said that he was treated like a doctor for the most part. Now, B. May, do you think he was treated like a doctor because he was a male? I'm just throwing that out there because there's been times where, like, if I walk into a room with a student and, for example, and I'm wearing the white coat, they will ask the student in scrubs like, "Oh, are you the doctor?" So it's that implicit bias, and it's sometimes, you know, I will say sexism is still very much alive. So Mr. Midwife said, as an NP, I can work independently. PAs must have a supervising position. And certain states, you can work independently as an NP. So yes. Mr. Midwife says, come join me, Liz. So yes, like in Florida, we can, if we apply for that license, if we have a certain amount of hours, we can work independently. Mr. Midwife is being sarcastic, but yes, my Y chromosome automatically makes me a doctor. Exactly. That I feel that it's true. I mean, I've experienced that. I don't know. It's not everybody is like that, but um, so Nurse Les says, pregnant people scare me, Mr. Midwife. Yes, yes, me too. And Liz, I have to get, if you guys ever want to be panelists on my teeny weeny tiny little channel, feel free to join. But I don't know, I'm gonna have to look into how to share the link like you share the link. If anyone else wants to ever join, feel free to join. So that was, May said, yes, that's true. And that's probably the best advantage of the NP being independent. We had to fight for that and got it. So that's exactly why I was saying, like, we have to be very careful about how we present our profession. And that's why we have to go to good universities, good schools, and just be good overall NPs. But yeah, any other comments or questions? I thank you. I mean, this has to be the best live I've ever had. My friends joined, Nurse Liz, Mr. Midwife, Nurse Adrian, B-May, thank you so much for being here and for your input. Just curious, B-May, did your dad ever tell you to become a PA? So exactly, evidence-based practice. And if you aren't, I mean, you really should, but if you are not, make sure you start practice evidence-based practice and not just what you feel like doing. That's very dangerous. And Nurse Liz, thank you so much for being on the live today. I really admire you. I think you're a great human being and you are doing so many wonderful things, and you're so open and transparent about your struggles and being an NP. So it just means a lot to me that you joined. Mr. Midwife, thank you for May. I just read your comment. Mr. Midwife, thank you for joining, and I will figure out how to get you guys on. May said, I asked if he wanted her to become a PA. He's like, he's sexist and thought I'd just get married. Well, I'm glad that you followed your own route. And Nurse Liz says, everyone don't forget to like the video. It pleases YouTube. Yes, it does. Nurse Liz says, thanks, friend, right back at you. And so thank you so much for tuning in, and have a wonderful, wonderful evening.